Dr. Edward Chan, the Principal Consultant Psychologist at the International Psychology Center. I'm also the President of the Malaysian Association of Psychotherapy, and I sit at the board for the World Council of Psychotherapy representing Malaysia. I also am the Chief Editor of the International Journal of Psychotherapy, Counseling and Psychiatry, Theory, Practice and Research Methods. But my main interest is to help my patients to get well from various psychopathologies or psychological illnesses.
Okay.
And one of these main illness is depression. Depression actually means literally to depress, to press down your feeling. Okay, so when someone is depressed, they feel very pressed upon. They feel like empty because everything is pressed down in them. So they feel nothing. So contrary to popular belief, a depressed person do not just feel sad, but on the contrary, they feel nothing. So that is the depression. You feel nothing, you have no mood, you have no energy, you have no interest, you have no interest even to eat or to have sex or to love, you just feel nothing. So that is depression. A depressed person will have lost all their interests in doing anything, in meeting people, in their work, in their relationship, in learning, in hobbies. So just they have absolutely, there are degrees of depression, obviously. At the most severe stage, they will have totally lost interest in all these things that normally would have interest in. But at the beginning level, they would have less interest, but they still have some of the interest. Okay, depends on where they are. So essentially, a depressed person will not be able even to get out of bed because they have no interest whatsoever to do anything. They would just be in bed all day. Yeah. So you have a total breakdown, if you like. And we have many patients, unfortunately, at that level, where they have absolutely no interest in life. And ironically, we'll talk about treatment later, but as we treat the patients and they start to get better, they get well, is actually they will come to a dangerous stage. When they get some energy back, but they're still depressed, but they will have enough energy to want to kill themselves. So the risk of suicide actually starts to increase as the patient get well. When they're absolutely severely depressed, they don't even have the energy to kill themselves, right? But when they start to get well, they will develop the energy to kill themselves. So treating depressed patients is need to be monitored very carefully, and you need to monitor their suicide risk because it can be dangerous. Right. We need to identify causes of depression in order to begin a treatment program. And there are essentially two main causes for depression: psychophysical causes. Okay. At the physical level, we have chemicals in our brain called neurotransmitters. And these chemicals influence how we feel. And deficiencies in some of these chemicals, like serotonin and GABA, will make us feel depressed. So at the International Psychology Center, where I practice, we actually provide our patients a measurement of these neurotransmitters. We can actually do a urine test to measure whether you have a deficiency in serotonin or GABA, right? So we can actually identify whether you have a physical cause for your depression. And if you do, then we can treat accordingly, not using the psychiatrist's method of psychotropic drugs, which is very unnatural and give rise to a lot of side effects, because what psychotropic drugs do is they block artificially the breakdown of neurotransmitters. You need to understand that neurotransmitters like serotonin go through a cycle, right? They get produced in the brain, and then they get broken down, and then they get produced again. So what these psychotropic drugs do, like Prozac, Zoloft, they will block the breakdown of these neurotransmitters like serotonin. And in doing so, the patients may, in the short term, have more of this neurotransmitter. But they do not produce more neurotransmitters, so eventually they're going to run out as well. So you need higher and higher dosage of these psychotropic drugs. So that is the side effects, and you have a lot of addiction effects, withdrawal effects when you stop these drugs. So our solution is to provide the building blocks for these neurotransmitters. So this is called psychonutritional medicine, which I'm training. So we provide things like tryptophan, 5-HTP. These are just very simple amino acids which has no side effects, but they will have the effect of increasing your neurotransmitters, thereby treating the causes, if it is indeed this physical cause for your depression. Yeah, so that is a physical part. And on the psychological causes, we will identify, in our assessment, to see whether it is the way that you think, rather negatively, maybe from influence of your childhood, of your parents, where you might have a highly critical self, where you are very critical of yourself, thereby causing you to be depressed. Or there are unfinished business. Yeah, maybe you are having some needs, attention from your parents which you never get, and now you get married to someone who also do not give you this attention, so you feel depressed. So these are all psychological causes, so we need to treat accordingly using psychotherapy. Either individual psychotherapy, where we would help you to deal with all these negative thinkings that you have, like cognitive behavioral therapy, CBT. Or we use couple therapy, where we work with you and your partner together to go back to the source of these unmet needs. I have developed a new model of couple therapy called imago drama therapy, which I will be presenting in Paris with my colleague Louis, in the upcoming World Council of Psychotherapy conference in July, end of July this year. So we might want to, in a lot of cases, combine both this psychological treatment, psychotherapy, couple therapy, together with the neurotransmitters, nutritional therapy. And with that, then in most cases, our patients will be able to recover rather quickly from their depressed state and begin again to enjoy life, enjoy the work, enjoy relationship, and contribute to our society.